Good evening, ladies and gentlemen. We welcome you to the Royal Albert Hall for the Journal of Wound Care and World Union of Wound Healing Societies Awards 2020.
The next category this evening is Innovation in Technology-Driven Research Award. This category is sponsored by SANUWAVE. So I'd like you to welcome to the stage from SANUWAVE, Kevin Richardson, to tell us all about it.
Our first nominee for the Innovation in Technology-Driven Research is Ana Lucia Martins de Olivier Carey, Clinical Nurse Manager, Beaumont Hospital Home Therapies, Ireland. Anna has been involved in wound healing and tissue viability research for the past 8 years and has published 2 systematic reviews arising from her research, one on diabetic foot ulcer and another on pressure ulcers. She focuses her research on pressure ulcers in the surgical population. Anna employed SEM measurement within a surgical population in 2 hospitals. This technology facilitated a more accurate determination of the individual's responses to pressure shear, allowing for more person-centered, adequate, and timely approach to pressure ulcerization prevention. Our next nominee, Gustavo Moreira Costa de Souza, plastic surgeon, Hospital Felicio Rocha, Feliz Rosa Foundation, Hospital de Clínicas de Universidade Federal de Minas Gerais, Brazil. Gustavo presented a case series for fat grafting associated with negative pressure wound therapy in the treatment of complex wounds on the distal third and lower limb. Our next nominee is Dr. Wendy Cole, DPM, Director of Wound Research, Kent State University, USA. Dr. Wendy Cole has been a dedicated wound care advocate for 2 decades with interests in medical education, diabetic foot care, wound care, limb salvage, and clinical research. Her passion to help others has led her participate in humanitarian efforts, including a medical mission to Jordan in 2018 to aid the large Syrian refugee population seeking asylum from civil war. Her work was chosen as the top scoring oral abstract in the category of clinical research for her efforts utilizing molecular light camera, titled "The Use of Advanced Fluorescent Imaging Systems to Target Wound Debridement, Decrease Bioburden, Improve Healing Rates, and Provide Positive Revenue in an Outpatient Wound Care Setting." She is an early adopter of the dermaPACE technology. Our bronze finalist, Gustavo Moreira Costa de Souza. Our silver place finalist, Dr. Wendy Cole. And the gold medal winner, Ana Lucia Martins de Olivier Carey. Congratulations.
Thank you so much for the awards. Thank you very much. Hi, my name is Ana Oliveira, and I work as a vascular access clinical nurse specialist in an acute hospital in Dublin. In my role, I work with a multidisciplinary team, consultants and surgeons, and we assess patients for their vascular access for hemodialysis, and then we engage as well with the other services of the renal department. Well, what I enjoy most is actually the engagement I have with the patients and the possibility of educating them on looking after their vascular access, and so that they can achieve better outcomes. Well, I think it has taught me to appreciate the simple things that we normally take for granted and to look towards the future with hope. Yes. So I worked and I dedicated a lot of my time in completing my PhD research, and that's what brought me here. So in my research, I could show that new technologies, in particular SEM measurement, has an important role to play in the future of wound care management. This new technology helps us identify tissue changes that can be precursors to pressure ulcer development. And by identifying this, we can help the nurses implement new strategies that will effectively prevent pressure ulcers and hopefully tackle this long-standing healthcare problem that are pressure ulcers. Well, I think still related, unfortunately, with the pandemic. I think I'm kind of brought back into working in the ward. So I think my vision of continuing research is a bit on hold at the moment until things go back to normal, and then then I'll be thinking of going back into researching and looking into these what it's out there that we can improve patient care and as well nurse practice, because sometimes the research showed there was around 53% people from the surgical population that do develop pressure ulcers. So the aim would be to reduce this, and because these new technologies show us something that we can't really see, the potential is that we act preventively before it can develop into a major wound and pressure ulcer. So I'd say people need to continue in their work and persevere hard, because the fruits of that work will give them a great sense of achievement. And the fact that then they will implement it in their own practice, and what it will give the patients is going to be something very good. So I think this perseverance and working hard and believing, even though there might be obstacles along the way, which has happened to me various times during the research, you just need to keep going, because if your focus is improving wound care, then you need to keep going.
Next up, we have diabetic foot ulcer challenges and the use of advanced therapies for healing. Brought to you by SanuWave. Healing today, curing tomorrow. Before we start our webinar tonight, here is a short presentation from the sponsors.
My name is Kevin Richardson. I'm the CEO and chairman of SanuWave Health. We're a wound care technologies company located in the US, but with operations globally. SanuWave was founded in 2006 and uses electroshockwave therapy to treat wounds. We received our FDA clearance in 2018 and began our commercialization efforts in the US in 2019. This past summer, we acquired the assets from Cellularity called UltraMist, which is near ultrasound technology used to treat wounds, and also exclusive licenses for 3 other products: BioVance, which is an amniotic skin substitute; Interfill, which is an intra-augmental filler. The final product we licensed was from Nanovibronics. It's called Wound Shield. It's an ultrasound patch that you wear near the wound in between visits to the wound center. One of the things that when we set out as a goal, was to make sure that our products could work in the workflow setting of a wound care center. One of our KOLs treats 17,000 patient visits a year. He can't spend an extra hour treating a patient. So we really made it so that our products can work in 5 to 7 minutes. Both the UltraMist product and the DermaPaste product are applied that way. So it works in the workflow. And then also importantly, it can work in conjunction with other products. And that's one of the things that we are big believers in. And one of the reasons we're supportive of JWC and the ceremony here is that we're believers that there is no one solution for wound care. It's what are the tools that you can bring to give the best results for that patient. Our innovation and technology research is an award that we're very happy to be giving out this year. The advancements in wound care and wound care treatment over the last 2 decades have been tremendous. There's more diagnostics going on today than ever before. Handheld quick response diagnostics, which are going to help lead to better care of the patients. If you look at what wound would have healed 20 years ago versus today, we're making great strides due to the innovation and technologies, but we still have a long way to go. And so we want to make sure that we celebrate those people that are pushing the envelope, trying new innovations, and really bringing technology to bear on how we can help patients globally. The challenges are all driven by COVID, and that the lockdowns at the hospital and getting in front of our customers has been really difficult. But what it did was it forced us to think about how we communicate and how we train. The advent of more webinars. Even today, we're doing a JWC awards ceremony virtually. Those are the things that I think the challenges have pushed us to all expand our horizons on how we communicate effectively with our customers, and then those customers, how they communicate with the patients, how they're talking to them in the home setting, how they're treating them in the home setting. So out of these challenges of COVID have come some wonderful trends that are going to help patients on a global basis. We're trying to treat wounds on a global basis, and we always talk about we're trying to treat diabetic foot ulcers globally. Unfortunately, diabetes is a global phenomenon. It's only getting worse in some of the emerging markets. And so one of the challenges we're facing is how do we bring our products into those emerging markets to treat patients where access to healthcare is difficult. And with technology, we're finding tools that we can bring to bear. I'm excited about the Wound Shield product, which is a wearable product that they can take it into their homes. Dermapace, they could come in maybe once a week to get treated. So we're trying to make it so that it's easier to have access to the healthcare they need on a global basis. But those challenges, unfortunately, I don't see anything changing the trends in diabetes, unfortunately. And so our job is to make living with that and living with the complications from wounds easier on the patients so they can enjoy life. The advice I've been giving throughout the years is never give up. Never give up believing. Always follow through. If you are passionate about your beliefs, follow them all the way to the end. It would have been easy for Sanuwave to have not followed our path through to completion. We did. We believed that our technology, our way of healing, would benefit many, many patients on a global basis. And so we followed that completely all the way through. It would have been easy at times just to give up. And so I guess my advice to others is, if you truly believe in something, never give up. Follow your passion.
Hi, I'm Dr. Anna Sanchez, and today our topic is going to be on diabetic foot ulcer and challenges of advanced therapies and how these diabetic foot ulcer challenges are addressed and therapeutic ways through the advanced therapies. My inspiration, as you see on my right side, that's me many, many moons ago. And that's my dad. He's my inspiration, my friend. He was a diabetic patient who ended up with a diabetic foot ulcer on his 5th digit. And he developed very concerning for osteo. They amputated his leg. They did a baloney amputation, and they went ahead and cut his leg. Within 48 hours, he developed sepsis from the amputation, and he proceeded to die. So I lost my best friend, my dad. I was already a physician, but this pushed me to make sure that other people's dads doesn't happen what happened to my father. So my inspiration is to make sure that other people's dad is going to be treated better than my dad. So I've been doing diabetic foot care for 25 years. And in the 25 years, I've been using standard of care, and I saw that people were not healing, or my diabetic foot ulcer patients were not healing. As a result, I looked into the percentage of healing with standard of care, and it was a horrible number, 70 to 55% failure to heal on these diabetic foot ulcers. That kind of prompted me to look into advanced therapies and see how we can improve our patient care and not just the standard of care. So I became real passionate, not only just to heal diabetic ulcers, but also to find advanced therapies that can help my patients with these challenging diabetic foot ulcers. So the advanced therapies I will discuss today is the negative wound pressure therapy, UltraMIST, dermaPACE, and biologics. So overview of ulcer healing. There are stages to the ulcer healing that I'm sure everyone is familiar with. This is hemostasis, inflammation, proliferation, and remodeling. Unfortunately, these stages, if they are sequentially happening on a cellular level, then you have adequate healing. But our diabetic patients, unfortunately, get these stages interrupted, or they fall out of sequence, or they become stagnant. Typically, the diabetic foot ulcer patients stay in the inflammatory state, and it doesn't actually heal, and we have to find some method to get them out of that stagnant situation. So what is our goal with our advanced therapies is to increase angiogenesis, which will give us growth factors as stated here, and increase cellular proliferation and decrease cellular apoptosis, which means cellular death. So our challenges for our diabetic foot ulcers are the microcirculation. Unfortunately, even with distal catheterization, bypasses, the cutaneous microcirculation, which is the capillaries, are actually not existent, or they diminish with time due to age or their metabolic state, like diabetics. And unfortunately, the capillaries start to become more rare, and therefore called rarefication. Less capillaries means more nerve damage, and the nerve damage then causes the protective threshold to be non-existent, and the patient then develops bacteria, and it's just a tremendous challenge. So again, we want to stop the interrupted healing process. We want to make sure that the healing process is not out of sequence and it's not stagnant. The first therapy that I will discuss is the negative wound pressure therapy. It is also known as a vacuum-assisted closure. The device is consistent of suction, or you can see here a vacuum pump, some tubing, a film to seal the suction pad, and the actual dressings help remove the exudate from the wound or the wound base. And the device is usually using subatmospheric pressure of 75 to 125 millimeters of mercury. So what do we accomplish with negative wound or negative pressure wound therapy? We actually decrease inflammation, increase perfusion, and increase granulation tissue, and decrease bioburden, increase cellular proliferation. So all these are part of the healing stages. The decreased inflammation will actually stop the macrophage or the leukocytes being sticky, and this is just going to be a great situation to prevent bacteria from coming in. Also in hospital settings, some of these negative pressure wound therapy has something called installation, where it actually cleans out the wound bed as it's actually creating the pressure. Now, the pressure can be from 75 to 125. It could be intermittent or constant. Typically, I use 125 millimeters of mercury constant, and I lower it down if the patient is experiencing pain. The UltraMIST ultrasound. So the UltraMIST ultrasound provides a low frequency ultrasound to the side of the wound, and it actually uses a non-contact saline, as we see here in this picture. And that will be the vehicle of delivering the low frequency ultrasound. And this low energy removes the slough to the base of the ulcer, fibrin, exudate, and bacteria. So overall, the patient experiences 79% in pain reduction, because it's a direct relation to diminishing the inflammation to the ulcer. The area of reduction in 8 weeks' time usually reduces by 85%, and high levels of bacteria are actually delaying the healing process. So by creating this mechanical stress of low frequency ultrasound, we can actually get rid of the bacteria and reduce the bacterial count. So overall, the effects of how it affects this challenge of diabetic foot ulcers is reduction in bioburden, reduction in inflammation, improved perfusion, vasodilation, accelerated new blood vessel formation by increasing VEGF, which is the vascular endothelial growth factor. One of the things that I like to look at ultrasound, I call it my terminator, because it terminates the bioburden that's present. And a lot of times with the ultramist, the bioburden, which is a colony of bacteria, has an altered cell wall called the exopolymetric matrix. And it's very difficult to remove that, even if you actually debride it. And it's hard to disrupt even with systemic or topical antibiotics. So this therapy of ultrasound is very helpful in creating this barrier that disrupts healing. The next advanced therapy is the dermaPACE. The dermaPACE is an extracorporeal shockwave therapy. The technologies have been around about 30 years. It was used initially for lithotripsy, and it's a high energy acoustic wave causing mechanical stress at a molecular level, and it reduces inflammation. It also helps in tissue edema from bone and soft tissue swelling. The shockwave impulse achieves healing. It increases, as you see, the effectiveness on the challenge of a diabetic foot ulcer. It increases angiogenesis. It diminishes the leukocyte stickiness of the endothelial lining, which is very common in ischemic patients. It's pro-angiogenesis, or increases angiogenesis, increases cellular activities by increasing the PCNA growth factor, which is a proliferating cell nuclear antigen, and is a precursor to DNA to help with tissue repair, increasing cellular repair and proliferation. So increased cellular activity removes those stagnant, interrupted, or out of sequence wound healing stages, and decreases cellular apoptosis, which means cellular death. So it actually creates a balance of TUNEL, which is the terminal deoxynucleotide transferase, and that balances out so that there's less apoptosis. Now, I call the dermaPACE my wound care or ulcer care defibrillator. Why do I use that comparison? Because if it's stagnant in a cardiac arrhythmia, dysrhythmia, the defibrillator, when you apply the joules, 360 joules, it actually reestablishes the effectiveness of the cardiac circulation in the heart and puts everything back into rhythm. So dermaPACE, using this high energy acoustic wave, actually helps the cells remove from that interrupted process or out of sequence and stagnant processes, so it goes back to a normal process of stage of healing, from hemostasis, inflammation, proliferation, and remodeling. The next is the biologics. The biologics is another method of treatment that I use in healing patients. I use it both before, during, and after any advanced therapy, depending on what the need of the wound is. And so the biologics, how it addresses our diabetic foot challenges. First of all, it's a human-derived biologic products that I use in assisting my diabetic patients to heal from their ulcers. Examples of the biologics that I use in my practice is Biovance, NuShield, Dermagraft, PurePly, and Affinity. So some of them are human amniotic membrane. The Dermagraft is bioengineered human fibroblast. The PurePly is antimicrobial wound matrix. Now, all these, there's so many other products that's available in the market, but I've used this because the patient population that I have, their insurance covers these, and unfortunately, the insurances dictate what kind of biologics we use. but I try to use the human amniotic membrane, which is very wonderful to create a scaffold for healing and in a wound that is recalcitrant. Treatments that these biologics provide for diabetic foot challenges is increase in human growth factors, increase in human fibroblasts, increase in granulation tissue, it diminished exudates, and faster healing rates. Usually with biologics, we actually see anywhere from 8 to 10 applications, I would say on 90% of my patients, but there are those who have those very difficult cases that I'm going to show you here on the next cases. So case number 1, I used actually negative wound pressure wound therapy, Ultramist, Dermapaste, and biologics. So this is a 75-year-old male who came in. He was in a rehab. He had gangrene. He had a transmetatarsal amputation of his foot, and he had osteomyelitis, and they went ahead and cut half of his foot. Well, when he presented to me back in 2018, both the heel and the anterior surface of his foot was all necrotic, very difficult patient. The recommendation for this patient that I was told by his nephrologist is that an amputation would be the best thing for him. The patient has a protein energy malnutrition where he cannot consume the food he takes in and actually produce the right proteins to actually aid in any kind of healing. So the prognosis was very poor. So this is one of my difficult cases. We proceeded then to do Ultramist. The Ultramist ultrasound helped me relieve the bioburden, increase angiogenesis, and the Dermapaste reestablish, I believe in theory, some mesenchymal autologous stem cells to allow for a recruitment of angiogenesis, increased microcirculation, increase our red blood cell velocity, increase capillary density to the area that is of defect. And you can see here on January 4, 2021, completely healed. This is the back of the heel. And he also had in the anterior surface, also all necrotic tissue. So 75% of his foot was all necrotic. What's very interesting is that when we had him in the hospital, I ordered an MRI, and in the MRI, it showed bone marrow edema. Well, the bone marrow edema is usually typically present when you have osteomyelitis. So we proceeded to do the gold standard, which is a bone biopsy to see if he had osteo. And the results came in from histopath, and he was actually negative for osteomyelitis. So why the bone marrow edema? Well, I believe that that was a direct relations to the Dermapaste treatment that the patient received. Somehow it caused bone marrow edema, and my theory is that, of course, this has to be proven, that that increased the bone marrow and production of all the right growth factors that he needed, including autologous stem cells for adequate healing. The next case we're going to talk about is case number 2. He was a 69-year-old male with diabetes who was out in Galveston having fun, broke his hip, ended up in rehab, ended up with a deep tissue injury, as you can see on the back of the heel. I picked 2 cases for the heel because the heels are one of the worst challenges, or the highest challenge, for diabetic foot healing, because it's naturally avascular from a capillary standpoint and just very difficult to heal and offload, and just because of the bony prominences in that area. The patient did have a negative pressure wound therapy, Ultramist, and Dermapaste and biologics. As you can see, 18 months later, the patient has just got a little bit of callous, dry skin to the back, and he proceeded to heal. Also, I was advised that he needed an amputation, and I told the patient, well, you have nothing to lose. Let's try all our advanced therapies, and let's see how we can make this better. And I'm glad we chose that route. It was 18 months, but it's worth saving his legs. The next case was case number 3, is another 61-year-old male who we use also the negative pressure wound therapy, the UltraMist, the dermaPACE, and biologics. So this patient presents to the hospital with gangrene and a tremendous abscess on his 3rd and 4th digit, which he lost. The doctor or the surgeon had to resect the base of the wound, get all the abscess, all the bioburden, all the bacteria. He did proceed to put a biological tissue and he secured it with actual sutures on there. This helps keeping the integrity of the tendons healthy, and also this area was an exposed bone, so it was protected from the environment. And then we proceeded immediately with the negative pressure wound therapy, UltraMist to help with the bioburden, dermaPACE to increase angiogenesis, microcirculation, diminish inflammation, and proangiogenesis and increase growth factors to help him get to a healing point. So this patient started in 2019, and this is how he looked on 10/6/2020. I actually followed him last week, and he's still healed, and it looks pretty in pink. So we will proceed with the next patient. This patient is a 40-year-old male who his A1C when he came in was super high. He said he did not have a glucometer. His A1C was, we have an instant A1C machine, and it actually showed that his A1C was greater than 13, and he didn't really have a good potential for healing at that point. He developed flesh-eating bacteria, which he lost his 5th digit, and he had a deep abscess involved with that. As you can see, tendons and bone. We secured it with a biologic tissue for advanced therapy and secured it with sutures. We proceeded with negative pressure wound therapy, the UltraMist to remove the bioburden and help with removing the bacteria that are there. So with the UltraMist, one of the things that I like about the UltraMist in this particular case, it helps with VRE, MRSA, E. coli, all these difficult cases that the systemic or oral does not really remove. And all of my diabetic foot ulcers, it does help, systemic and topical, but the UltraMist is wonderful to combat that situation. And so we will show the last picture, which is butterflies. Now, butterflies, I thought was very interesting. They have taste receptor on their feet to help them find the host of plants that they're going to actually locate their foot, or excuse me, their foot. So their food, they pick, and they're picky, so they start drumming on the leaves and until they get the plant that releases the juices that they need to survive, to sustain their self. And on the spines and the back of their leg have chemoreceptors to detect the right match of plant chemicals in order for them to sustain life. So I picked that because we underestimate the feet, and I feel that if we take care of the feet and use advanced therapies, we will promote the stages of healing, which is hemostasis, inflammation, proliferation, and remodeling. We don't have interruption in the process of healing, and the sequence is maintained for the right order of healing, and the stagnant ulcer chronic situation is removed by using these advanced therapies. The UltraMist is a wonderful device or advanced therapy to decrease bacteria, inflammation, and increases reperfusion. The dermaPACE by increasing microcirculation, the diameter of the vessels, increase red blood velocity, decrease inflammation, increase proangiogenesis, increase growth factors. So we too can be picky with our receptors of our feet to release the right device advanced therapy so that we can actually have the right healing to have quality of life and maintain our lower extremity. I want to thank you for staying with this presentation. I love healing patients, and I hope you enjoy this presentation and also find the same passion to heal our patients with these chronic, difficult foot ulcers. Thank you.